As a collective result of our efforts, especially of care colleagues across the country, 62% of care homes have had no reported cases of coronavirus. And today's figures, released by the Office for National Statistics, show that the number of deaths in care homes has fallen significantly, down by a third in just the last week, from 2,423 to 1,666. This morning's statistics confirm that 27% of coronavirus deaths in England have taken place in care homes, which compares to a European average of around half. But whatever the figures say, we will not rest from doing whatever is humanly possible to protect our care homes from this appalling virus, to make sure residents and care colleagues have the safety and security they deserve.
Can the Health Secretary explain why guidance saying care homes were very unlikely to be infected wasn't withdrawn until March the 12th, when the Chief Medical Officer warned about community transmission and the risk to the elderly on March the 4th? NHS England rightly asked hospitals to free up at least 30,000 beds to cope with the virus. But can he explain why there was no requirement to test those being discharged to care homes, the very group most at risk, until April the 15th? It took until mid-April for the government to produce a social care plan, until the end of April to say all residents and staff should be tested, and until the 11th of May to set a deadline for achieving this. And that deadline still isn't until the 6th of June. Can the Health Secretary explain how he squares all this with his claim the government has thrown a protective cloak around care homes right from the start?
We have made social care a priority from the start. The first guidance went out to social care in February. She refers to the March the 13th guidance. That was only a matter of days immediately after the risk to the public was raised on medical advice. And the guidance that was in place until then, as she probably knows, explicitly stated that guidance was in place whilst community transmission was low, and said it would be updated as soon as community transmission went broader, and that's exactly what we did. It's important to remember that hospital can be a dangerous place for people, as well as saving lives. It also can carry risks, and does. And so it is appropriate and a clinical decision, and appropriate in many cases, for people to be discharged from hospital and safer for them to go to a care home. What's important is that infection control procedures are in place in that care home, and those infection control procedures were put in place at the start of this crisis and have been strengthened, exactly as she says, as we've learned more and more about the virus all the way along. And as the clinical understanding of coronavirus has strengthened, so too we have updated and strengthened our guidance.